What type of doctor will I need to see to treat my MDS?
So, a person who has a newly diagnosed myelodysplastic syndrome should always see a hematologist oncologist. Some people identify themselves as just hematologists, some as hematologists and medical oncologists. I think it's always worth a second opinion when you have a diagnosis of myelodysplastic syndrome, and I say that for a couple of reasons. First of all, it's a relatively rare diagnosis. So we estimate that about 20,000 people in the United States each year will be diagnosed with myelodysplastic syndromes. Compare that to 220,000 women with breast cancer or 220,000 men with prostate cancer. Compared to breast and prostate cancer, it's relatively rare. So you really owe it to yourself to see a specialist and to have a specialist pathologist review those bone marrow slides and make sure that it's truly a diagnosis of myelodysplastic syndrome.
How do I become more knowledgeable about MDS?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
The second reason I say that is a study that we conducted through the National Heart, Lung, and Blood Institute, where we showed that pathologists will disagree about a diagnosis of myelodysplastic syndrome about 25% of the time. So if you have a serious diagnosis like myelodysplastic syndrome, and 1 out of 4 times a local pathologist will come up with a diagnosis that an expert pathologist disagrees with, you owe it to yourself to go to a specialty center for MDS and get that expert pathologist to review your bone marrow slides.